Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo. Hello, welcome back to the Our Forever Smiles podcast. We are continuing our series at the ACPA meeting. We are so excited to have Dr. Canallatos here today, and she works in dentistry. I will not attempt to share the specifics of your specialty,
Sure.
but I will allow you to introduce yourself.
Okay, yeah. So I'm Dr. Jessica Canallatos. I am on the Craniofacial Team in Buffalo, New York, and I'm a prosthodontist, so it's a dental specialist. I specialize in prosthetics, so like anything fake going into the mouth. So that can range for like today's purposes, that's like NAM, so like Nasoalveolar Molding prosthetic, all the way to like speech aids, obturators. Stop me if you don't know what these are.
No, I know.
And, those are things that can help, close any holes, we'll call them, in the mouth. So for cleft palate. And then like dentures and like implant prosthetics, implant retained prosthetics, I do those too. So I get to kind of be around at a lot of stages in these patients' lives, which is really rewarding and nice.
Yeah, that's wonderful. So I always like to ask everyone, why cleft care? Why did you choose, out of all the things that you could have done, right? Like
I know. So I was born with a cleft lip and palate and unilateral, and I was a patient at the center that I work at now. And I always really liked how my surgeon, Dr. Robert Perry, he actually is still on the team. He's the plastic surgeon for the team. He always kind of had this like air about him that he just like knew like what to do. And when you're like a kid like going through this treatment, you're kind of like feel like lost and like scared.
Yeah.
And it's nice to have someone who like kind of just says like, okay, so very calmly too, like this is what's next, this is what we're gonna do, this is gonna help you because X, Y, Z. And then Janice Rockwood, she's the team coordinator. She was also there when I was a baby, when I was born. She's still the team coordinator now too. She also has this air about her that it was like, oh, Jan's in the room? Okay, I'm taken care of, I'm good.
Wow.
Because she just remembers all the patients, she remembers everything about them. So because of the two of them, I knew I wanted to be in the medical field. First, I was like, maybe a pediatrician. I think like I was 7. I'm like, pediatrician, I know that they work with kids. And, yeah. So then it wasn't until so I'm missing 2 front teeth because of my cleft lip and palate. And I have dental implants. I got dental implants when I was 19. And a prosthodontist restored my teeth. And that was when I knew, okay, I want to do dentistry, and I also want to be a prosthodontist. Because after I had my teeth restored, I had my smile, which is also my confidence.
Yeah.
So every time I noticed this, every time I had some kind of procedure for my teeth, for my smile, my confidence soared, and also something in my life would like happen. And it's because of the confidence,
Yeah.
So I'm like, okay, so there's something connected to this smile thing. So I want to do something for smiles.
Yeah.
Like I want to restore people's confidence through their smiles, because that's when I felt the most confidence myself.
Yeah. Oh, that's incredible. Oh.
Yeah. So then I went to dental school, and I'm like, I'm going to be a prosthodontist. So then I did my pros residency. And then in my residency, I said like I want all the cleft lip and palate patients. So I was able to work on those patients. That's how I learned. And then I moved back to Buffalo, and I pretty much I told Jan, I want to be on this team. What can I do? What can I do? What can I do? So then I was able to get on the team because the craniofacial orthodontist was leaving the team. And she said, well, we need someone to do NAM, so you can be on the team that way. Can you do NAM? And I had never done NAM before. And I said, yes. I said, of course.
And that's a pretty I feel like that's a pretty tough area to go in. Well, just like managing the emotional aspects and stuff with parents, and then also just, I guess, the precision, right? I mean, I imagine, I don't
Yes.
know, that you have to have, and just seeing them, I guess, like, what is it, every 1 or 2 weeks?
Yeah, I see them weekly, yeah.
Yeah.
So I think the prenatal discussion helps a lot because that's when the parents are able to kind of work through those emotions. I would say 99% of the time, you know, the parents are crying in the room and it's just a very emotional time. And, you know, sometimes I tell them I was born with a cleft lip and palate, sometimes I don't, sometimes I wait. So it is always like a very comforting thing for them to know that. So I do like to tell them, but I kind of pick and choose when I tell them. But yeah, I think the prenatal discussion helps a lot because they're able to kind of work through those emotions, and then when the baby's born, it's like, okay, I'm ready to go. Like, let's start the treatment. Let's do this. So I definitely notice that parents are totally on board and ready to do whatever is necessary as soon as their baby's born, which is really nice and helpful for us too, to do what we have to do.
Yeah. Have you ever had the opportunity, this audience is mainly cleft moms and cleft parents, and we also have grandparents.
Kind of emotional for me. My mom passed away. Today's the anniversary of her passing, actually. So it just kind of happened.
Please.
I know. So
sorry.
Yeah, May 9th, 2013, she passed away from cancer. But yeah, so first I'll talk about, I was just talking to Jan yesterday, the team coordinator for my team, and she was saying how the thing that she admired most, the thing that stuck out about my parents, is that they always came to the appointments together and they supported each other. And
I'm sorry.
No, this is probably like meant to be. Okay. So they came to appointments together, and I have 3 other siblings, and they would never bring my other siblings. It was always like, Jessica's the focus, like, and they always asked, she said they asked really good questions, and you know, my mom would come with her like papers. I'm sure a lot of the moms do this. They had like folders and papers, and you know, when's the next appointment, what's next, like following up on what was being, thank you, what was said last time, because as you probably know, things, as good as a team can be, things kind of can slip through the cracks sometimes. So it's really important for the parents to be the advocate for their child. I feel like I'm getting off topic here, but yes, so my mom was always very supportive of me, and I feel like she like thought I was like cool.
Well, I mean, so the thing that I was going to lead into is that, I mean, so many parents go into this journey like, is my child going to be okay?
Yeah, exactly.
And I think that, sorry, no, I'm crying. Now to see like how far you've come and been able to like.
Yeah, like I'm just a normal person. Like,
yeah.
I have 3 kids who are not affected. Of course, when I was pregnant, at that anatomy ultrasound, I was nervous, but it was also like, well, you know, if it does happen, I know it's going to be okay because I'm okay. You know, emotionally, like psychologically, it can be difficult with bullying. So there's a lot of talk at this meeting about bringing awareness and, you know, having actors with craniofacial differences starting to be like in movies, just like as like a friend, like it's just like an actor, like not like it doesn't have to be the focus of the movie. Yeah. So I think that's really important. But yes, that was difficult. But what was the most helpful for me was knowing that my family was always there. Like I knew I could just like go home and be normal. Yeah. Like I knew that they were supporting me. So the support that you know, all these cleft parents are giving to their children, it really, really means something. It's just like I knew I could always count on them to like show up. So it's really important.
Yeah. I think that, yeah, and that it's valuable to hear that as well. I think that a lot of it, I've been trying myself with the podcast to, you know, we have a lot of episodes with moms that are coming with their newly diagnosed, right? And that's it's a really, really hard time for the mom. And just that first year is so incredibly difficult. And so I have been trying to get more voices on the podcast that do address kind of like that school age, where now it's kind of moved from the mom needing that psychological or just mental health support, and now it's moving towards like your child having to deal with, it's no longer about you. Your child is experiencing all these surgeries that maybe their friends don't have to have. They have a facial difference, you know, they're being pulled out of school, and it's those conversations of, you know, this isn't fair, and that type of thing. And then, you know, of course, I always want to be a resource in how can the moms support their kids through that part of it, right? And so I think that is really, really valuable information. I think that the ACPA meeting has changed, right? From what I've learned, this is my first meeting, but how many years have you been coming?
Since I was in dental school, I think, so a lot of years.
Yeah, and so is this like you've seen it kind of evolve into what like their focuses have become?
Definitely, yeah. I really like this year how the focus is really moving towards awareness and how to support parents and the kids going through it. Yeah. It's not so, I like that it's not so much about like the technical parts, it's about like the psychological parts.
Yeah, I love that too. I think that there's a wonderful balance here. Because, right, the studies and the clinical pieces of it are, of course, it's valid. Like, I want to know what the latest and greatest technology that we have. Sure. We talked about like Plana and stuff as an alternative for NAM, and I think that all of the things are great. People have all kinds of feelings, right, about different things, but I just think it's so wonderful to have that. But just in going back like to the NAM, I guess what is a way, so I've known parents that have really struggled, like really bad with the NAM. Okay. And I've also had like doctors and professionals like yourself that have said, Laura, it breaks my heart that so many people come on your podcast and they just are struggling with the NAM. It's like really literally sad. Not kidding. Yeah. Like we'll talk about it with parents, like, oh, what was your experience with the NAM? And it will bring them to tears, just like we were crying. Like even just thinking back on those days. Yeah. And it's a lot. Yeah. So I guess like how do you approach that? Like if you do see someone that is a family that's struggling with the NAM, and what's your approach to that?
So if they're struggling with the NAM, I first see like what it could be. Like, is it the soreness of it? Is it like how it's going into the nose? Like why? Like what is the reason why first? And then if we can't fix it, if it's more of like I hate shoving this thing into my baby's mouth and having the tape all over the face, and then that's like a great indication for Plana, like something like Plana. It's an amazing alternative. I had one family who really struggled with feeding in the hospital. This is like one of the things I really think about with Plana. They teach you how to feed the baby without anything in the mouth in the hospital. You can't leave the hospital, right, until the baby can eat, of course. And then a week later, we're putting in a NAM, and now they have to learn how to do.
I never thought about that.
That's mental torture. So I had one family who like had that difficulty in the hospital. They finally got it down, they were feeling confident, and now I introduced this NAM. And they're like, right away, they're like, I don't feel confident with this, like this is not going well. I said, well, just try it out, let's see what happens next week. So I give them a week, and it just wasn't working for them. So that's when we switched over to Plana. And they like thrived on Plana. So it's an amazing, I don't even want to call it an alternative because I think it's like a good thing to offer right from the get-go too. But it's an amazing resource to have. So Plana is game-changing for these patients and parents who are struggling with the NAM. Most of the time, I don't want to say that they're not struggling with the NAM, but most of the time my NAM patients are okay as long as the feeding is going okay. I feel like it's a big feeding issue.
Yeah, that's a great point. It does, like, because in the beginning that's like it's so crazy because I've tried to stress this at this meeting so much, that how much the feeding is like with the SLPs and like how they should show parents prenatally how to feed the baby or what the options are, give them access to all the bottles, because maybe not.
Yeah, you're right.
You know, Dr. Brown's didn't work for my daughter, so I had to go with Pigeon, and like that entire like process of like now they're feeding. Now when they get, that's the bulk of the stress, because if your baby's hungry, they're gonna be crying, and if they're crying all day, then
you're like, you don't want to put that NAM in their mouth.
I'm gonna like. So that is if they can get the feeding down. Then.
So I don't know if these parents are seeing the feeding, like I like to have them, I'm in the same building though as the feeding specialist, I'm in the hospital. So if I make sure they can bottle feed before they leave, if they can't, I'm calling that feeding specialist and getting them there.
Yes.
And they'll come. Like,
yeah.
I don't know how these other hospitals are, but the feeding specialist will come and help. So maybe it's a matter of scheduling that ahead of time, calling the feeding specialist and saying, hey, I'm inserting the NAM on Thursday at 2 o'clock. Can you please be there too? So it's like it's set in stone that they're going to come and they're going to help support the parents, because I don't know much about feeding. I need someone, you know, who does to help out.
Yeah.
And if the feeding can be taken care of, I think that would alleviate a lot of the stress.
Yeah, working closely as you mentioned with different members in on the Cleft team, and using like the NAM or Plana. Have you, I guess, have the surgeons on your team been like feel good about the results that you've been able to produce with either the Plana or the NAM,
Great
whichever
question.
option?
Yeah, great question. So NAM consistently gives good results. It's just slam dunk. So the surgeons love the NAM. Plana also gives amazing results for the nose shape, amazing. And the only complaint I've had with Plana is that there's a lack of control of where the ridges end up, which can affect the lip repair. So if the ridges are out of alignment and we have to jump over a ridge to close that lip, that's going to affect the outcome of the lip repair. So I had one patient where that was a complaint. That's the only complaint I've had with Plana. Other than that, it gives great nasal symmetry, and the lip align that they have now, that lip taping, is like phenomenal. It really helps to close. It like closes the lip. And the lip looks amazing, and then with that, you know, the ridges follow, like the inside of the mouth follows, but you can't control where the ridges end up. They're not going to be perfectly, you know, touching. So that could be a complaint of some of the surgeons, but I mean, really, they love both of them.
Yeah, it's give and take for any of the journey.
So I just have to be careful with which cases I select for each one. I give the parents the option, but I'll also make a recommendation. If it's a very wide cleft, I'll recommend Plana, because the chances of those ridges kind of like overlapping and getting wonky is less. But if it's closer together, then if they're going to touch eventually, I want them to touch the right way.
Yeah.
So that's when I would use Plana or NAM.
Yeah. And so just thinking about how you were sharing with your own personal journey and how you saw this like drastic, you know, confidence shift and just like the changes that the prosthodontist was able to make for yourself. And so now in your own career, how are you able to kind of like reconcile the pressure of like, hey, functionality and aesthetics? Like, how are you able to sort of focus on both, I guess, at the same
time. Okay, I hope I'm going to answer your question. Let me know if I don't. So in my specialty, we always say, form follows function, function follows form. So like if something looks right, that means it's functioning correct. And if it's functioning correct, that means it looks right. So, am I answering your question? Mm-hmm. Okay. So, what that means is like, if I'm putting teeth in there that are like way too long, they're not going to sound right when they talk. So the form, the look of it is affecting the function. So I need to make those teeth look right, and if they look right, then that means that the function is going to be correct as well. Ask me more.
No, that was it. Before, in other interviews and stuff, I've heard that it's like we're always focused on function first before
really?
aesthetics.
Okay, I feel like with dentistry it's different.
Yeah.
Because it has to, so I'm in dentures all the time, and if they look weird, then if they're not gonna sound right. Like they're not gonna function correctly. Picture dentures. If they have like these really long teeth and the patient's like full of teeth, how are they gonna eat?
Yes.
Because there's gonna be no space to eat.
Yeah.
Right? So they're not gonna function correctly. So for me, it's about form and function.
Yeah.
It's both. They go hand in hand. They're not separate for me.
Yeah, and this is that's a great point, because that's absolutely right. If you see someone that has teeth that don't necessarily look right, it's like the function is compromised there. Right. Versus, so when I ask this question to surgeons, they're of course thinking about function, quality of life. Correct. Always first. Yes. Over the aesthetics, although they say that the aesthetics are also important, right? Because they want to see the before and afters. Definitely. Yeah. Yes, so sure. It's one of those things that there's no right answer, right? Because both are so critically important. Yeah. And so, so I understand where you're coming from that aspect. So I think that dentistry is a long road for a lot of patients. So my daughter was, she's actually cleft palate affected only. Okay. And so she's had her repair. She's 2 years old. Okay. And so, I always like to think that we are over the hardest part of her journey, right? But now there's other things that have come into play, like her, she's very nasally, she's, she just snores a lot. And so she's always congested, always scratching her nose, that type of thing. And then also she has some teeth that have grown in underdeveloped. Okay. So it was a hypomineralization, which is, I have heard that is common in children that were born with the cleft. So it is although that this can happen to a child that, wasn't born with a cleft, it is a part of the thing, her mouth breathing and just there's the general things that happen. Yes. Yes. And so given that this is kind of a long road, how do you kind of help your patients understand this long-term roadmap without overwhelming them with all of the information?
I think the important thing is in the beginning to just tell parents it's going to be taken care of, and the patients, but she's too, but it's going to be taken care of, but not necessarily say okay, when she's 6 we're going to do this, when she's 8 we're going to do this. I think that's very overwhelming for parents and patients, because that's what was done to me at least, and I did not like that. I was okay, it's you count down the years, okay, well when I'm 11, they said they're gonna do my lip, but they're saying things probably around 11 years old we'll maybe refine your lip. But in my mind it's okay. So at 11 I'm getting my lip done, and at 16 I'm getting that big nose surgery. So I think it's really important to not put these timelines on it and just say, don't worry, it's going to get taken care of. So that's probably good advice for the moms and the dads out there, caregivers. to not say like, okay, when you're 8, okay, like let's look forward to when you're 8, because also it builds it up, and then the outcome, you know how when you build something up on anything, it's like you expect it to be like the best.
Yeah.
So there, you gotta just get set up for disappointment, because it's not going to be what you've built it up to be.
Oh, that's an incredible point.
Yeah.
The first thing I thought of is, so my stepdaughter, she's 8, and her mom will tell her about her next birthday, like what they're doing, because they usually go on a trip.
Okay.
And so she'll say like, okay, next year we're going to Jamaica. And so she will talk about it all year long, right? She knows when I turn 9 or 8, you know, I'm going to Jamaica. So she'll tell everyone, I'm going to Jamaica, and it's like, you know, and so you're right. Like in that young age, you do build up to this moment, right? That's like a normal thing, whatever it is, right? Yeah. But then the other thing that you said that I feel like another cleft affected person shared with me as well is that you build this thing up in your mind. She was actually going for, I believe, like a rhinoplasty, right? Yeah. And she was so excited about it. And this is even in adulthood. Yeah. She was so excited about it. And she said, once it was done, nobody noticed. Yeah. Yeah. And so that's like one of the, you know, the harder parts of the journey, right? Yes. Yes. And so that just made me think of it. She felt good about it. You may know her. She is Ashley Barber on Instagram, Cleft Love IG.
I actually don't know her. I
no.
Look her up.
Yeah, no,
I'll have to meet her.
Yeah, I don't think she's here, but she's she does stuff with Smile Train all the time. Okay. And when we were talking during her episode, she shared that with me. She said, you know, a lot of times that's how you know, you kind of like reconcile whether at that moment she was realizing like the surgeries that I'm going to have moving forward are going to be because I want them, and because it's like, you know, something that I had to kind of realize that it is for me, you know. But yeah, I think that I hadn't, you know, thought about that you know, people that have a cleft, you know, could feel that way. And I'm sure she saw a difference, but she was maybe expecting people to say like, you know. And I've also heard people say that they would love for, and it could be different now, right? Like so many things have changed, that they thought that after each surgery that they would just wake up looking totally different. Yes. You know, that they would like. Yep.
And it's like, oh, well, I kind of look the same.
Yeah.
Which is also like that function thing, like how surgeons are so into the function. But it's such like an aesthetic concern. Like, kids are not thinking about function. Like, we're thinking about aesthetics. So that there really needs to be an emphasis on the aesthetic part too. Yeah. So, yeah.
Has that resonated a little with like your journey as well?
With the aesthetics?
With the aesthetics, and just kind of like feeling like, you know, are you done with surgeries?
Heck yeah. I mean, sometimes I like think about.
You see, everyone.
But it's like, why? Why am I going to do that? And it's like, well, maybe because, you know, in pictures, sometimes I like will stand on this side, my unaffected side. It's like I kind of want to never do that again. I don't want to think about that anymore. But will the nose surgery fix that? I don't know. So do I want to put myself through that nose surgery just to like hope that will fix that? I don't know. But still undecided. I should be done with surgery, is what I should say. Like my dental implants failed. After 10 years, so when I was 29, they failed. So I had to get new ones. I had to go through an alveolar bone graft again. But I was 29.
So you like
implants? Yeah, from the hip, everything. Yeah. Then I had to get new dental implants and then teeth again. And so that wasn't that long ago.
Yeah. Does that happen? Like, could it fail again?
That was like very bizarre how that happened. It's very strange for that to happen after 10 years. Yeah. Dental implants usually fail in like the first couple of years, not even, like less than that. So it was a very bizarre thing to happen. I don't know how it happened, but it did. And that was too much for me, so I'm done with surgery.
Yeah.
I don't know.
You can do whatever you want.
I
Yes,
know.
you can. You own your journey.
Yes.
What do you think is a commonly misunderstood aspect of your role on the team?
Ooh, that's a great question. Okay, so what do people think I do on the team?
That sounds like me at work as well. It's like, I wonder what people think I'm doing.
Okay, so here's a complaint about the surgeons, okay? So even within the team, they think that I'm kind of just like sitting, because what they do are like procedures like in the OR, right? So like when they have like clinic time, they're just like seeing patients like fast, like consults, right? 15 minutes. But like my OR procedures are like in the chair with the patient awake. You know what I mean? They're not like, so like just to compare. So they kind of think I'm like sitting around all day like waiting for them to like text me and be like, I need you like to make this for me. So what's not understood is that I'm doing like long procedures, but the patients are awake, and it's during clinic time. It's outpatient procedure. So my time is eaten up by seeing the patients during my clinic time. They're not just consults. I'm actually doing treatment. I'm, drilling down a tooth or making something out of acrylic, trying it in the mouth. The patients will scream if it hurts, like they're awake, and I'm like doing patient management and the procedure. So that's like a commonly, I always joke, like the hospital has no idea what I do. I think.
Yeah, underappreciated.
Right? Gosh, yeah, you hit me where it hurts with that one. But yeah, I'm like actually like doing stuff. Like I'll get a text from the surgeon. Hopefully they don't listen. Like, hey, are you gonna be around tomorrow? Yes, I'm gonna be around. And they like want me to do something, but they're not telling me because it's just like, oh well, she'll be around. So.
She'll just be available, just there for me. Oh goodness, yeah, no.
So yeah, it's procedures that I'm doing. They just don't happen to be in the OR. That's it.
Yeah. And my last question, what do you wish general dentists knew about treating patients with craniofacial differences?
Amazing. Refer them to me.
Take them back.
So treating these patients, if it's out of your scope, don't do it, because you can really it can really hurt the patient. I'll see obturators that are made by someone who's probably never made an obturator before, and this patient's been wearing it for years, and it's just like not made correctly. And the patients don't know that it's not made correctly. So, okay, for general dentists, treating patients with craniofacial differences, like definitely work to where you're comfortable. And then when you're not comfortable anymore, seek help for sure. A prosthodontist or an orthodontist or whoever can always guide you, guide the dentist on what to do next, but definitely just work to where they're comfortable treating the patient, and then ask for help.
Yeah, love that. Yeah. Thank you, Dr. Canallatos.
You're welcome.
It's an honor to speak with you today.
So nice
it really is. And
so
sorry we cried.
It's fine. I feel like everything's always meant to be, like the universe kind of like conspires to like whatever is meant to be will be. So it happened. So it's fine. It's good to cry. Get it out.
Well, thank you.
You're welcome.